Welcome to TCN Talks. The goal of our podcast is to provide concise and relevant information for busy hospice and palliative care leaders and staff. We understand your busy schedules and believe that brevity signals respect. And now, here's our host, Chris Como.
Hello, and welcome to TCN Talks. I'm so excited today. Our guest is Judi Lund Person. She's a principal with Lund Person and Associates, LLC. But of course, we all know Judi for her 21 years where she served as Vice President, Regulatory and Compliance at NHPCO, the National Hospice and Palliative Care Organization. And of course, she served as a key contact with CMS and other federal agencies, helping to ensure that NHPCO's voice was heard with the policymakers. Judi, so good to have you. What else does our audience need to know about you?
Well, I always think it's fun to, to get a little bit more personal so that people don't think that I work 24/7, but I have two kids, a son in college and a daughter who is working in the court system here in Loudoun County, Virginia, where we live. So they are very important to me, and that's been a joy, over the years. So. That's I think a really good extra.
Well, Judi, I can't remember when it was you and I were talking, but it feels like it wasn't too long ago. And for me, this was near and dear to my heart. And I know we have a lot of listeners where I started hospice at Four Seasons. And you even knew Jean Hoekstra, the lady who started Four Seasons Hospice. And,
right.
I've never asked you, how in the heck did you get into hospice? Can you tell that story?
Oh, it's such a funny story. And I think what I would want your readers to know is you never know when something you do or somebody you talk to changes the course of your life. So I think that's what I would start by saying. I was fresh out of college. I was living in Raleigh and North Carolina, and I was working for state government, and I was already like, this is not for me. This is not for me. I don't think I can do this. And I was flying home to Iowa, where I grew up, and I was on a flight from Raleigh-Durham to Chicago. I get on the plane, and there is a man at the window and a woman at on the aisle. I had the middle seat. I hate middle seats. But I think one of the things that I realized right after I sat down is that the woman on the aisle was holding on to the arm rests of her chair, and her knuckles were just like white. She was so scared. So I turned to her and I said, it looks like you might be scared. And of course, I'm a social worker by training, so I felt like my social worker training was coming right out. And she says, yes, I've never flown before, and I'm flying to Las Vegas to see my son. I turned to the man at the window and I said, please help me reassure this woman that everything is going to be okay. And he says, everything's going to be okay. And he goes back to papers that are spread everywhere.
Thank you to our TCN Talk sponsor, Delta Care RX. Delta Care RX is also the title sponsor for our April and November 2024 Leadership Immersion courses. Delta Care RX is primarily known as a national hospice, PBM, and prescription mail order company. Delta Care RX is a premier vendor of TCN and provides not only pharmaceutical care, but also niche software innovations that save their customers time, stress, and money. Thank you, Delta Care RX, for all the great work you do in the end-of-life and serious illness care.
So middle of the flight, he and I start talking, and I said, just normal airplane, chatter, nothing out of the ordinary at all. Said, where are you going? He says, well, I'm going to Chicago for the first meeting of the National Hospice Organization Standards Committee. And my job, and it turns out I learned much later, he was on the board of the National Hospice Organization. And he said, and my job coming to this meeting is to bring the job descriptions of all the members of the interdisciplinary team. Well, and then he reveals that he is a chaplain. He worked at that time at Duke Hospital. And so he said, well, I went to Duke Hospital, HR, and I got all the job descriptions for the nurse and the social worker and the this and the that. And he said, so I'm all prepared, except I don't know what a volunteer coordinator does. I said, well, it happens that that's what I do for state government. And so then we started this long conversation, and we should remind our readers, but remind ourselves that this is before email, before the internet, before social media, before any of those things. So I said, here's what you can say when you get to the meeting, and then I'll send you some stuff when I get back to the office. Well, that started me down this path of helping him with what does a volunteer manager do? And then he would call and he would say, do you want to serve on our board? Well, this was the board, the original board of Hospice of North Carolina. And I wasn't there for the first meeting, which was, let's see, I don't even remember kind of when, but like the late 70s somewhere. But the first meeting they said, we want to form a hospice. We want to be in North Carolina like the Connecticut hospice. And 75 people came to the first meeting, and they said, we don't want one hospice. We all want our own hospice. And so in the middle of that very first meeting, they changed the focus and the mission of Hospice of North Carolina to be the state organization. So first state organization in the country, really by demand of citizens of North Carolina who said, we all want our own. And so I was on the board then, and the board was very raucous and, we demanding, and everybody wanted their own thing. And so then the executive director, who was a retired Army colonel, decided to retire from this job. And Peter, the chaplain, called me and he said, well, do you know anybody that might want to work, be the director of Hospice of North Carolina? And I mean, in my young, late 20s mind, I've already been in state government for just over 5 years. I can't stand it. It is like way too rigid and regimented for me. And I said, well, I might be. So we started down this path of, we'd had a bad experience with an employee before, so I had to meet with a psychologist. And we met with the psychologist, one of the people from the Episcopal Diocese, and I met with the psychologist on the grounds of the Capitol in Raleigh. And we knew it was okay when a pigeon, there are lots and lots of pigeons, a pigeon flew overhead and dropped pigeon poop on her shoulder. And so we were rolling with laughter. And so the whole goal was she would call Peter and say that I was okay. So I guess I made the cut there, but but you never ever know. I mean, it started because I talked to him on the plane. I hardly ever talk to people on planes. So it has been and all for a long, long time, every single year. I started on the Monday after Thanksgiving. Every single Monday after Thanksgiving, I would call him and I'd say, everything's okay. I'm doing well. How are you doing? This is the anniversary, so, and I started working in 1980. So there was no Medicare. There was no any of that. And the whole goal was to drive around North Carolina and help communities get started. So that's how I met Jean and Dick, who started the hospice in Hendersonville. So I'm sorry, it's a long story, but it's fun because I think, any of us could say, oh, wow, just one question could have turned into some path that I never expected to go down. And that's where I was.
Oh, my gosh. That is so beautiful, Judy. So, gosh, I want to do that justice. And so, first off, thank you, because I'm sitting here reflecting because of you. There was a Four Seasons. That changed my life. I actually... a funny story. So I had no intention of taking the job at Four Seasons. I actually wrote a pretty cool blog about it, and it's actually the beginning of my second book. I told my wife I was kind of brush up on my interviewing skills. But when I met Jean and the team at Four Seasons, I so bought into their passion. So there wouldn't have been a Four Seasons without you.
Right.
my life changed. My family's life changed. This is where I call home now,
Yeah,
near
of course.
Hendersonville.
Mm-hmm.
And so all because of an incredible conversation with you on an airplane. I just read this book this weekend, Judy, called Synchronicity.
Mm-hmm.
And it talks about that whenever like these synchronistic events. And I think probably if we polled a lot of people in this amazing field of hospice, there are probably a lot of similar stories. One of my favorite visuals of cause and purpose intersectings, if you picture this beautiful mountain lake and the raindrops start hitting it and the concentric rings start intersecting. And I think we have so much of that in this amazing field, which will be an interesting segue because I think we're at an interesting crossroads, don't you?
Oh, absolutely, yes. Absolutely.
Well, so here is my first question. And first, thank you. I'm so glad I asked you that question. I'm just sitting here with goose pimples thinking about what you just shared. And again, it changing my own personal life and my family's life. And I can think probably a lot of our listeners, because how we're all intertwined with each other.
Right.
Well, Judy, you're at this interesting stage of your career where, I mean, you really could just ride off in the sunset and retire. You've had an amazing, just an amazing career, and then not even knowing the beginning of the story till now. So there's got to be something motivating you that you still want to be part of this work. Can you speak to that?
Well, I've done a lot of introspection. I think that's probably the best thing to call it. And one of the things I thought to myself is, age is a state of mind. It's not a number. And so when I was considering like slowing it down just a little bit so that I wasn't working quite so hard and not with my family quite so much, I said, well, I could do something different. I don't have to be cold turkey. One day I work and the next day I don't. That didn't feel like the right sort of move. And so the piece for me that continues to drive my own passion is I want to make sure that patients and families get the care they need and get the care they want. I said to somebody not long ago, I said, my mom was a hospice patient in 2006 in Iowa. And so it changed me. It obviously, she was very short, 7 days of hospice care at that time, but it changed from talking kind of not theoretically, but knowing the regulations and knowing the kind of the underpinnings, to saying to the nurse who was admitting her, when the nurse said to me, before she knew what I did, before she knew I worked for NHPCO, she said, well, and she had aspiration pneumonia, and she said, well, we'll be discontinuing her antibiotics because that's what we do in hospice. And I'm like, what are you talking about? And I said, no, I won't agree to that. This is before she knew anything about my background. And it gave her a start. And she's like, okay. Then I said, I'll agree we won't start another course, but we're going to continue this one. Then I'm not a nurse. I'm a social worker by training. So I could say a few nursing words. And creatinine was not one of the ones I needed to use, but O2 sat I could do. So, well, can you tell me what mom's O2 sat is? And she told me the number, and she said, why are you asking that question? Are you a nurse? And I said, no, I hang out with nurses. So by the end of it, she knew what I did, and she and the social worker were very thoughtful about how to put the plan of care together. But as soon as she left the hospital where my mom was, she's in the elevator. She calls her director, who I knew, and said, do you know whose mom this is? So, and it's the thing that still drives my passion. It's like, I want people to have the kind of experience that they deserve. And, all the sort of things we say, like, you don't get a do-over in hospice. You don't. You don't. We need to make sure that the patient and the family are together in this. Are things that are so ingrained in me that I think that's what I go for. That the other part, and we may go farther on this, but the other part is I want to make sure that bad hospice care is out of here. I don't want to hear. I worked on a case recently, which was featured in the latest ProPublica story on hospice, where the patient, nursing home resident since 2010, dementia, daughter was the power of attorney, and she was admitted to hospice fraudulently. Never one single visit was made, and and the daughter could not get her off of hospice. So no, we're not going to stand for that either. And that's, I think, the other thing, in terms of what drives me now, that's it. Those two things are really important.
Well, Judi, when you and I were talking about doing this show, I think we're going to call this Judi Unleashed because I feel like I could feel your passion in that. And so just speak about that a little more. I think you even did a presentation just a couple weeks ago. It was in the Midwest somewhere, just some of the things that you're exposing. So I feel like you're able to kind of speak truth into something that needs to be spoken over. So you want to take that a little bit?
Sure. So, I think what and I will only talk about publicly available data. So that's, I think, just a disclaimer at the beginning. But I think what we're looking at in the 4 states that have a enhanced oversight. So at the moment, and that enhanced oversight started last summer in July. But what we're seeing is physicians who are hospice medical directors who have been their license has been suspended for opioid use. And this is something I heard yesterday. The medical board in this particular state said, well, you are not allowed to prescribe opioids to anybody except for patients in hospice. What? What are you talking about? Why did that happen? So that's sort of one piece of it. Or we see physicians who are the hospice medical director for 60 or 70 hospices. How is that possible? Or we see hospices who, most of our listeners will be in Medicare certified hospices. Maybe some folks who work in hospice now have no idea what that initial survey was like, but it's tough. But how can it be that a hospice would be surveyed for Medicare enrollment or get licensed? Let's start with that. And then be certified for medical enrollment in 3 months and start taking patients. How is that possible? Yep. And I think those of us who really know what's going on in hospice and know how it works, we have a responsibility to call a spade, if you will. Really, really, really important. So, I think that's what we are seeing is hard.
Yep.
Depressing. And I was talking to somebody this morning, and it's like, okay, you go from what to angry to sad to crying to back to angry, and it's like, okay, we got that. Got
to do something about this.
That's what feeds you. So.
Well, let's, I'm sure the good thing is most of the listeners listening to this podcast are not those people.
Thank goodness, right. Thank goodness.
So they'll fuss at me if I don't get into some of the amazing things, but I think they'll also be very confident to know that Judi's on the job for those sorts of things.
Right.
So recently the Federal Register published the 2025 Hospice Wage Index and Payment. Conditions of participation, hospice quality, reporting proposed rule. So what are some of the changes that stand out to you, Judi? Because I bet you stayed up all night. In fact, I know you told me I had a call right before. You're like, I'm waiting for it to come out. I'm like, I just love you so much, Judi.
Well, and I wrote a blog post for somebody yesterday, and I said, I realize that not everybody is a regulatory nerd like I am, but so I think one of the comments is finally. So that would be one of the things I would say. And finally, the HOPE tool is out. And just calling everybody's attention to what it looks like and what the implementation will look like and how that will impact, because it will sunset the HIS. And start to talk to your software vendor about how you're going to make sure that the HOPE tool is ready when the software is ready, when the HOPE tool is ready to go. Finally, we have a revised hospice CAP survey. We have a shortened survey. We have some changes to the wording of the questions, which is I've spent a lot of time on it, and very good changes to the questions so that it's a shorter, a little bit more understandable, etc. Finally, we have a web-based email ability to do the survey online. I think for all of us, and even as we look at special focus and some of the other related issues with enforcement, we need more people participating in responding to the CAPS survey. So, the web-based part of it will make a huge difference. Those are all interesting. Interesting and very important changes to our benefit. Now, we have the 2.6% increase. It's not what we want. It's also not final. So just for our listeners, watch for the final rule to see what the final rate increase will be, but use that 2.6% to start doing your budget planning. But I think the sleeper in this, and the place I would want every provider to look, is how does your wage index compare to last year? So every 10 years, the census drives a change in the core-based statistical areas. Counties that were rural now become urban. Counties that were urban now become rural. Of course, I always look at North Carolina because I know those counties so well. And so, pay attention to what that does to your rates, because the rates are going to be connected to what your wage index is. And if your wage index has dropped, your rates are going to drop as well. And I think for some people, they depend on either the MAC or the national organizations to put out the rate chart. Do your own calculation. And I can send you, Chris, the way to plug in your own numbers if you want that to. And instead of sending you a Christmas cookie recipe, I will send you that. But all of those are, I think, part of this proposed rule.
So the Hope tool, Judi, do you think that this is our version finally of an oasis that's going to get more and more complicated, almost like an acuity type scale?
Yes.
Can you speak on that just a little bit?
Well, so what the Hope tool is looking at now is admission visit, 2 nursing visits interim, and I forget what the lingo is for that, and then a kind of a summary at discharge. So definitely more visits than HIS required. And then also embedded, once we get Hope up and running, then we'll add process quality measures as well. So looking at pain and non-pain symptoms, those are already in this proposed rule, and they will be activated once Hope is up and running. So I think, just from what CMS has said, what others have said, Hope is the hospice version of OASIS, and we'll begin looking at some of the metrics, the data collection that could be used for additional quality reporting, may drive some of the changes to HCI, the Hospice Care Index as well. So I think it's going to be really important. And I also want to make sure that people are staff, nursing staff, other staff members are completely engrossed and embedded in what does this mean for us. And so I'm sure all of us are going to be looking at what does this mean for Telios? What does this mean for the hospice provider in California? What does this mean for all of us? And just also a reminder, I am so frustrated that 18% of hospices do not participate in quality reporting. Yep. And so a lot of that is the hospice CAP survey, but some of it is they don't meet that 90% threshold either. So just a reminder that do everything you can while we have this year or so, or year or more of preparation to get up to speed and get your metrics in place and your systems in place, so you can get above that 90% threshold and not lose money because of it.
Yeah, I'd never heard that statistic. That's almost 1,000 hospices, considering how many. That's incredible.
And I think, for CAPS, 49% of hospices participate or have publicly available data. So we've got
big
work to do, lots of work to do.
I'm just thinking of, we're in the Amazon generation, right? I mean, how many of us go on Amazon? The first thing we look at is the reviews before we press buy.
100%, yes.
And the baby boomers are becoming more and more our customer, which has not been the case most of our careers. Wow, that's a big mismatch. Well, Judi, they'll also be mad if I don't ask you. So it feels like it's been a busy time. And so the whole announcement about the Vbid demonstration carve-in not moving forward, I'd love to hear you talk about that a little bit as well.
Sure. So I think, the Center for Medicare and Medicaid Innovation, CMMI, has decided to sunset the hospice component of Vbid, so value-based insurance design. Had a low participation by MA plans, a lot of complicated and annoying and irritating system issues. Prior auth was never allowed. We had, a lot of billing-related issues, slow pay, and so. For all of us, I think people were cheering because finally we're out from under Vbid. And I guess the place I would want to go is do not relax. Do not, my favorite, and probably from my childhood, is don't go and pull the covers over your head and say, this is it. If I just stay here long enough, nothing will happen. Because, MA continues. And now we will have to look at other ways that MA will want to have hospice or will want to provide hospice to their enrollees. We also have a huge rise in accountable care organizations. I know you and I have been talking a bit about that as well. So it's not that hospice is immune from some of the things that are like the newer things that are happening now. It just happens that this very complex and difficult, with not a lot of bang for your buck, if you will, in Vbid is gone away. So don't cheer. I mean, yes, cheer, but don't cheer.
Do you think that this is a window, Judi? Because, obviously the demonstration was driven via the insurance company.
Right.
And I think of like the trajectory of originally DCE, and then that morphed into Reach ACOs, and it really opened for sophisticated community-based hospice or any type of hospices to participate. Do you think we might end up in a similar situation, or maybe this window might create an opportunity for many type of organizations that come forward?
Oh, I think so. And I've been doing a lot of reading about ACOs and some of the new things that are happening there. I think we should all be paying a lot of attention to kind of what people are talking about there, and what kinds of things might be places where hospice could help, places where hospices that do pre-hospice palliative care services, could they jump in and help in those kinds of areas? So both things I think are really, really important.
Well, Judi, as you you could spend your time on a lot of different things. Do you have kind of a rubric of like, this is Judi's priority areas where she wants to be spending time going forward?
Well, I think the National Association of ACOs is meeting in Baltimore, which is 45 minutes to an hour away, later this month. So I have been entertaining the idea of going to that, just to get immersed. And I think many of us will want to do the immersion kind of process. Unfortunately, I will know tonight whether I get called for jury duty. So if I get called for jury duty, I won't be able to go to that meeting. But oh well. I think another thing is just to continue to connect a lot of different dots around fraud and abuse. what can we uncover when we look at publicly available data? What can we uncover that gives us pause? And then share what gives us pause with the appropriate, could be CMS, could be OIG, could be FBI, could be Department of Justice, or we begin to have a lot more conversations about what's right and what is this. This doesn't look quite right. So that, I think those are the places where I'm expecting to spend a lot of my time at this point.
Well, that makes me smile because I was just reflecting, listening to you talk, just thinking about your purview. I mean, what you've seen over the years as this movement has gone from a living room, front porch, church basement movement. Now you have publicly traded organizations, but you also have these horrible fly-by-night.
Right.
I think it was a presentation, again, was it Nebraska maybe?
Mm-hmm.
And you had pictures of like burned out like buildings with addresses, and that is not hospice.
That is not hospice.
That's not even a legitimate business,
Right.
much less one that's supposed to be caring for the dying.
Right.
So that makes me smile, that knowing that Judy's on the job and playing offense in that area. And every hospice, regardless of tax status or whatever, should want Judy to be doing that, because that sullies the name of, like, the word Kleenex, the word hospital and hospice. It paints the whole movement in the same way.
Well, and that's our challenge. It's like, so do we open the door and do we look in and do we say, we've got to get this under control because it does impact the whole community? Or do we say, it's just over there, we're not going to really look at it because it's not going to come to us. It is coming to us. And,
absolutely.
California has done some awesome work in establishing a moratorium for licenses. So what do you think some of those people do? They go to neighboring states. And we've got to, a moratorium is one option, but we've got to really look at a lot of different ways to get at some of these issues.
Yeah, I think I'll share with you, I have a family member who I care for deeply, but he's been a serial entrepreneur, and we hadn't seen each other in forever. And so I'm just catching him up, where I spent the last 30 years of my life. And he looked at me and he said, a lot of people dying. It's probably a pretty good business. I should look into that. And I'm like, no. But I think that's kind of generally what that, and it's not that you don't want entrepreneurial minded people, but I don't care if you're making software, if you're caring for the dying, if you're not in it for the right reasons.
Right.
And I've heard you say so many times, we don't get do-overs. We don't get do-overs in this.
That's right.
And there's not a lot of entry barriers in places where you don't have a CON. And this is not like building a hospital or an MRI center, so it doesn't take a ton of capital.
Right.
And so because of that, I think it does generally attract some not so good things, as we've seen.
No question. And I think we have stories from some hospice owners who say, yeah, I bought, I have 5 Medicare certified hospices, and I'm giving one to each of my children, and they can run them. True story. Yeah. Or we say, well, this medical director, we don't need him that often, so he can serve some other hospices. Well, when you look at the data, it's 20 hospices, or it's 40 hospices, or it's 70. The worst was 70. So, I think the entrepreneurial side of this is driving a certain amount of this. So that's going to be the hardest nut to crack, I think.
Yeah, that's what I kind of love about kind of you and I. I mean, I grew up in the business world. Right. I grew up in the Fortune 50 world. Yep. I remember going to my first NHO conference, and I think I was one of maybe 5 males. Right. The men's bathroom had no line whatsoever.
Exactly. Yeah, exactly.
But seeing how that's kind of shifted, and I get business, and you got to have, the nuns coined the term, no margin, no mission. Right. But again, I don't care what business you're in. If you don't really care about the product and the quality of the product, but especially people that are at the very end of their lives, there's something definitely wrong with that.
Well, and I think then it's when we come back to where we started this conversation, which is the patient and the family are our North Star. That's who we're doing this for. And so anything that harms them, it harms all of us. And we just, I don't know, we can't have that,
Well, and what also, it feels synchronicity, that you're on the job now in this way, kind of Judi Unleashed, because I do think the beautiful thing about the baby boomers is they've transformed every part of our economy as they've aged. And they've always been traditionally more demanding. They've kind of upset kind of traditionally how things were done. So I think that's another kind of cool confluence of happening at the same time. I think if they start to realize not all hospices are built the same, and that there is a big differentiation. And so I don't know if you have any thoughts on that as well.
Well, I worked with Don Schumacher in many of the years that I was at NHPCO, and he and I would say to each other, when we get to be the age where we need hospice or we need congregate living of some description, we're all going to expect to have a Starbucks in the lobby so that we can get our coffee fix. And we're going to expect way different things than our parents ever expected. And we're not going to take it lying down. We're going to be saying to that doctor, well, prove that what you want to do is the right thing for me. Tell me why you think that and show me the evidence. I think that's the baby boomer generation that I know many of us are seeing now. It's so different than what we've seen before.
Oh, that's so good, Judi. Well, final question. You have a lot of hospice and palliative care leaders, also staff, and interesting now board members. Picture it. I've used the phraseology before, a locker room talk, but you've got their ear. What would be your final thoughts that you want to share with them?
What I have said to a lot of people, and this is based on my own experience with my mom, think about one patient that made a significant impact on you. It could be a family member. It could be a person that you cared for in your hospice. Use that as your guide. What would that person want from whatever it is you're working on? And for me, it drives everything. So if we say, how would Charlotte like, what would she want if she were here today? Or what would my friend Bill, for whom I was a caregiver, what would he want? And I was his caregiver. He was my neighbor. We played poker at his kitchen table. He would want to be able to do that again. And so I think once we make it very personal, it becomes much easier to have passion, in my opinion. So there you have it.
Oh, I love that, Judi. In fact, the very last time we had Miss Jean, this was many years ago at a Four Seasons all-staff meeting, and you would be so not surprised that all the way into her late 90s, she could stand up and give an extemporaneous speech with no notes.
Not surprised.
But she said exactly what you just said. She looked at every staff member and said, basically, if this is not your passion, I hope you go do something else, because this is probably not the place for you.
Absolutely correct. So I will second what Jean has talked about before. Absolutely.
That's awesome. Well, Judi, thank you. And I'm so glad that you're doing this. And I asked Judi for a quote, and she picked an Angela Davis quote, I love Angela Davis. And so the quote is, as we always, our listeners, we leave you with something to think about. And this one is, I am no longer accepting the things I cannot change. I am changing the things I cannot accept. That's a perfect one, Judi. And thanks to our listeners for listening to TCN Talks.